How does ScarWork support the nervous system and a whole body integration? I'm Irvin Eisenberg, owner of Resilience Occupational Therapy and host of Resilience Radio. In this video, I want to talk about the ScarWork that I do and how it promotes a whole body integration and works with the nervous system that way. A caveat is a lot of our understanding of how the nervous system works and how scars work doesn't completely jive with the clinical experience that I have and the instructors that I've had. So anything I present here is theory as to why it might work or hypothesis, and it seems to clinically be effective, but is not necessarily been scientifically proven. So let's start off with how do scars affect more than just the scarred area. So you might have a scar from a surgery or a burn in a particular location, and that can actually start to pull on the surrounding tissues. That can be done either from an actual physical restriction and guarding that then might make it harder in this case to fully flex your fist. But it also can affect the circulatory system or the nervous system. So you might actually have some lack of sensitivity both near the scar site and distal to that site, or sometimes even more proximal. Proximal being closer to the body, and distal being further away, like the distance fingertips. So, in any case, you can have a nerve disruption, you can have a circulatory disruption. Additionally, if you're holding tissue because of the scarring, that can affect posture. You can imagine that I've been showing this with the wrist, but if you were to have a scar somewhere else, that can have an effect there. I have clients who have abdominal scars that as we work those scars, that seem to have an effect on their low back pain or even their neck pain, sort of how things travel through the body that way. Another question is why some scars feel numb and others hypersensitive. And I don't fully understand this, but it's the way the nervous system has integrated it. If you're guarding around a scar and it really hurts and you've never fully integrated that, it might be really painful. It could be that that scar tissue is grabbed onto and it's irritating nerves, and any touching to that scar actually can fire those nerves and cause pain. Additionally, if nerves have actually been severed from the injury, then the scar itself just might not have sensitization at all. And when I'm working with it, in both cases, I'm trying to bring awareness to that tissue, either in the case of a hypersensitive scar, working around it and getting the person comfortable with contact so it doesn't feel as strange and is more integrated. In the case of a scar where it's like there's nothing there, I'm trying to work around it and bring awareness to that scar as well. So the approach is actually different. I can, of course, be more rigorous when you aren't feeling much in the scar than if it's painful, and I always would adapt the technique based on what's needed. So you can have protection around a scar, which is like because you've had an injury there, you can be guarding. So we're talking about how does a scar get protected, and then we can do a whole body approach to help open things up. But if you're still protected in that area around that scar, it might be that some working in that area can help release that guarding. I try to do this not in an aggressive way because I feel like that further traumatizes already sensitive tissue. But I try to work with a scar in a very gentle, approachable way so that your nervous system isn't afraid to integrate that scar. Structural integration, which is actually what this type of scar work came out of, is known for deep postural changes, looking at how the fascial lines line up. And this scar work was discovered by a woman named Sharon Wheeler, who is a Rolfer who worked directly with Ida Rolf, and she was gently playing around with somebody's scar, just sort of doing some work with it, while actually like discussing movies or some sort of unrelated topic, and realized that the scar was integrating and softening, and things had improved. So she then tried to reverse engineer that and sort of would talk with someone and gently play with their scar, and then would kind of peek over at what she was doing, was trying to figure out what she intuitively was doing to help the scar to come up with some methods to work with it. But it's supposed to be gentle and playful and exploratory in a way that both appreciates the scar for what it is, but isn't trying to go deep and break up the tissue. So in any case, structural integration, as I said, is this full body approach to getting everything moving, and scar tissue is like one little, when talking about surface scar, it's one little area in which that can be pinned down. So it's one technique in the broader technique set that I have of structural integration, which of course is a set of tools that's in the broader technique set of the work that I do as an occupational therapist. If you have more questions about ScarWork, feel free to reach out to me directly or leave comments down below.